The global response to the coronavirus pandemic has led to extreme measures to slow the spread of this destructive virus. Public health experts have stressed the importance of social distancing as the key to slowing the spread.
While I know social distancing and the isolation it creates is necessary, I am really worried about my sister. I may be the only one that knows that her safety is at risk in her current relationship.
As a pediatrician, I evaluate children for suspected abuse. I worry that the extended periods of time in close quarters, along with the economic stress and all of the other factors facing families, might put even more children at increased risk. When this pandemic is stabilized, am I going to see a surge in patients who have been abused?
Ever since the social distancing guidelines have been put in place, I can't go check on my mother. I know her caregivers are working long shifts and are under a lot of pressure. All of this makes me worry about her safety.
These are voices of people struggling with potential violence in the homes of their loved ones. The CDC offers basic definitions to help all of us understand how to define the types of abuse that could occur in the home: intimate partner violence, child abuse, and elder abuse. Intimate partner violence, also known as IPV, is abuse or aggression that occurs in a close relationship. Intimate partner refers to both current and former spouses and dating partners. IPV can vary in how often it happens and how severe it is. It can range from one episode of violence that could have lasting impact to chronic and severe episodes over multiple years. IPV includes 4 types of behavior: physical abuse, sexual abuse, stalking, and psychological aggression. Child abuse or neglect occurs when a primary caregiver or parent inflicts harm on a child under the age of 18. This abuse or neglect can be physical, sexual, and/or emotional. 1 in every 10 adults over the age of 60 suffer from abuse, including sexual, neglect, physical, emotional, abandonment, or economic. While child abuse, intimate partner violence, and elder abuse are all different forms of abuse, we know that preventing abuse in the home starts with being able to recognize the signs and risk factors, and then knowing what to do about what you see. Here are just a few of the common signs to look for when you are concerned about potential violence in the home: isolation, withdrawal from friends, changes in appearance or behavior, mental health challenges, substance abuse issues, problems with school, loss of self-esteem or confidence, conflicting or unexplained injuries. If you are worried about a friend, family member, or loved one, here are a few tips to help. First, familiarize yourself with the national resource hotlines that are staffed 24/7 with trained professionals ready to assist. Child Help Hotline, 1-800-422-4453. Immediately report any suspicion of abuse. Intimate Partner Violence Hotline, 1-800-799-SAFE. National Sexual Assault Hotline at 1-800-656-HOPE. Elder Abuse Hotline, 800-222-8000. These hotlines will connect your friend or loved one with the supportive services they need. There are also other ways you can show support. Listen. Let them know you are here for them. Offer non-judgmental support. Help them develop a safety plan. That includes information on where can they go if things escalate, who they can call. Recognize that if they leave the abusive relationship, their safety may still be at risk. This means you should continue to offer unconditional support. Immediately report child and elder abuse to the appropriate reporting agency. Vulnerable populations like children and elders need that safety precaution. Instill hope in every conversation you have with them. Hope that their situation will improve, that survivors of IPV will have the strength to leave abusive relationships, and that children and elders will receive the protection they deserve.